Hi, I'm Olivia, a women's health exercise physiologist. This video is going to focus on some breath work and some gentle movement that you can do through your torso and abdomen in those first couple of weeks post laparoscopy. So whether the surgery was for endometriosis or other pelvic pain conditions. So whether you're in bed, because you're probably spending a lot of time in bed, which is okay, and obviously what we need to be doing resting. If you're more comfortable when you're propped up in bed, maybe you've got a few more pillows than this, so that you're like so with knees bent. I'm now 7 weeks post laparoscopy and I know that I didn't want to stretch out completely flat, particularly in the first week or two. So if you're more comfortable propped up with your torso and with your legs bent, that's fine. Maybe it's stretching out one leg, maybe it's two legs, or if you prefer to be completely flat with no pillows, that's fine as well. No matter where you are, we're going to be doing exactly the same thing. So I like to go one hand on the side, so fingers spread so that you're kind of feeling rib cage with your thumb and then belly with your fingers. But if you're not even liking the touch of your fingers on belly, you might like to go up onto chest or just by your side. And just completely laying here still. I just want you to observe your breath as it is right now. So is it feeling like they're quite small and shallow breaths? Or does it feel like they're quite deep breaths? Or somewhere in between? If you've got your hands on your torso, does it feel like most of the breath is happening from belly, rib cage, or maybe just chest and shoulders? If it's not already, trying to consciously change your breath to go down into your belly. So as you inhale, we want belly to gently rise. And then as you exhale, relax belly. Inhale, belly rises. Exhale, relax. Now, as you're doing this, I don't want you to force the inhale. You don't need to take as big of a breath as you can. It's still your same amount of air, but it's just happening in a different place. Maybe now that we've been doing this for a couple of minutes, you might like to straighten one leg out. So you might just be getting a bit of a stretch through the torso on the right side, on the one side. But can we still focus the breath into belly and rib cage? If you feel comfortable with two legs out straight, otherwise you can keep them bent, that's totally fine. Checking in that our legs are relaxed. We don't have any tension through our glutes or through our inner thighs. And if it feels comfortable, now starting to make your inhales bigger. So purposefully taking a big inhale, belly rises. And then exhale, relax, let it go. You might feel a little bit of pulling near your incisions or just in the inside of your belly as you do this, but it shouldn't be uncomfortable and it definitely shouldn't be painful. If it does feel like that, then just dial it back a bit. Now, not just focusing on the belly rising, but also the rib cage expanding. So next inhale, try and get your rib cage to expand sideways. And then still exhale, let it go. Go 2 more breaths. Okay, now just to get a little bit of gentle movement through your hips. So if your legs aren't already, bring them bent. Just go one leg fall out to the side. So you'll get a bit of an inner thigh stretch. If that's too much of a stretch and it's uncomfortable, pulling or pain, pop a pillow under that knee to support it. And then it will sit a bit higher. Can we still breathe into our belly whilst we're here? Go 3 breaths total. And then bring that leg up and then other side, so other knee falls out. And you might notice that one side feels more comfortable than the other. That's totally normal. So whenever you can throughout the day, just checking back in with your breath. Is it happening into your belly, or is it quite shallow breath into your neck and your shoulders? Really good to practice like twice a day, morning and night, particularly in the first couple of weeks post-surgery, particularly the first week or two when there's a lot of resting in bed and a lot of horizontal time.